Hello everyone, this is WLBT's Ask the Experts. I'm Kelly Boyd. Joining me in the hub today is Dr. Cameron Guild from Baptist Heart. Welcome, we're glad to have you here today, Dr. Guild.
Thank you very much for having me.
Great. So our questions come from the Ask the Experts page on WLBT.com, but if you have questions for Dr. Guild while we're live on Facebook, please join the conversation. You ready?
Of course.
All right. The first one comes from Miss Karen Tripp. She says, my calves burn when I try walking a long distance. Does that mean I have poor circulation?
It means that poor circulation is probably top on the list until you prove otherwise. Whenever you've got a muscle with an artery that's blocked that supplies that muscle, whenever you make that muscle work harder, it's going to give you the symptoms of the lack of blood flow, which with peripheral vascular disease or peripheral arterial disease, which is just blockage in the leg arteries, the more you work the muscle supplied by that vessel, the more symptoms you're going to get. So typically, the more you walk, the more those calves will burn. When you stop, it should ease off after 30, 60 seconds or so. But if those are the symptoms, there's a strong chance that it's peripheral vascular disease or a blocked artery to the leg. There are certainly other things that can cause similar symptoms, pinched nerves in the back, but typically that doesn't get worse with walking and better with rest. As classically as peripheral vascular disease does. So there's some pretty simple tests that your doctor can do to either exclude that or prove that that is the case.
Okay, and it looks like Miss Karen has joined us. Good morning, Karen. And Macy Kane asks, why can some doctors find my heart murmurs and others can't?
Oh, some are better listeners than others. Any doctor can hear or miss a murmur. In a quiet room, you know, when the patient isn't talking and you can really focus on the heart is the optimal time to hear a murmur. Some people are just better at it. I guess if you're looking for a murmur, you're more likely to find it. You would think you would just listen and automatically hear it on every patient, but I mean, it really takes a dedicated effort to hear them. The good news is, you know, generally speaking, not always, but generally, if it's a murmur that a lot of doctors miss, you got to figure how bad could it really be, right? Whereas if every doctor heard it, that would probably be a loud, more severe murmur, which would generally signify a worse heart condition. So if it's a very soft murmur, it's very easy to miss. I'm not sure to worry too much, but it's still worth probably getting it checked out. But it probably boils down to some people are just listening harder than others.
Wow, okay. And what tools do you use for that? Is it a stethoscope?
Yeah, so when you're listening, so before stethoscopes were invented, the cardiologist would spread a silk handkerchief on the chest and actually place their ear on the handkerchief on the chest, because you can hear that way too. You know, the noise is going to be transmitted through the chest wall. But things are a little more advanced than that. So stethoscopes are our main tool for diagnosing a murmur. And then not every murmur requires any further workup. There are definitely some qualities or locations of murmurs that would lead you to order an ultrasound of the heart, which would be the main way that you would screen for valve disease, because most murmurs of the heart, again, not all, but most murmurs are going to be related to valve dysfunction, some of which is nothing to worry about, some of which is severe. So if you hear something concerning with a stethoscope, generally you follow it up with a heart ultrasound or echo.
Okay, so a good thing to think about is probably not to talk when your doctor's using the stethoscope.
Yes, that definitely helps here. Otherwise, it all sounds like Charlie Brown's teacher in there. So.
Oh, wow. Looks like we have a lot of questions and comments coming in on the Facebook Live. We'll get to those in just a few moments. I'm going to switch to the questions that were submitted to the Ask the Experts page. The first one, second one, what are the symptoms of coronary artery disease?
Oh, that's a good question because the answer may change. It ranges anywhere from severe chest discomfort to absolutely no symptoms at all.
Wow.
A large number of people have coronary artery disease and have even had heart attacks, and the symptoms they had may have just been reflux. It's not uncommon in the ER to have somebody coming in saying, oh, my chest is hurting so bad, I'm having a heart attack, and you work them up and it's just reflux. And we have just as many people come into the ER saying, you know, I think I've just got a little bit of reflux. It's probably nothing. My wife made me come in. And we say, actually, you're having a heart attack. So there's tremendous overlap between symptoms of blocked arteries and lots of other things like reflux or musculoskeletal pain, but to the extent that these things can be predicted, generally speaking, chest pain that gets worse with activity is a blocked heart artery until proven otherwise. It can be other things, but if it predictably gets worse with activity and better at rest, that's a pretty good story for a blocked heart artery. Mm-hmm. Some people have just shortness of breath with activity. That's not as reliable a symptom because sometimes I get short of breath with activity if I haven't exercised in several weeks or months.
Yeah.
If I gain a little extra weight, I'll be more short of breath than I was before I had the weight. So, as we get older, we usually get heavier and more physically deconditioned, which is going to lead to shortness of breath attributable to that alone, independent of any coronary disease. So shortness of breath with activity can be blocked heart arteries. It can be lots of other things too. That's kind of a tough one. We get a lot of people coming in and say, well, I'm tired all the time. I'm so tired. Could that be blocked arteries? And the answer is, I'm tired all the time, and I don't think I have blocked heart arteries. So fatigue is so non-specific. It could be due to everything and anything, but generally speaking, physical activity gets worse with chest pain that gets worse with physical activity is probably the heart until proven otherwise. And a lot of times it's not the heart, but it's just tough to tell sometimes.
Okay, so better safe than sorry,
Sure.
of course. Yeah. Okay, what types of artery disease are most common?
If you have an artery in your body, it can get blocked. Heart arteries are probably statistically the most likely artery to get blocked, but arteries to the legs, arteries to any peripheral vascular organ, arteries to the organs inside your abdomen, arteries to the brain, the carotid arteries can get blocked. So any artery has the capacity to get diseased and blocked, but heart arteries are number one.
Okay. Let's see. Are there tests required to diagnose coronary artery disease?
To actually diagnose coronary artery disease, you would need some type of imaging study. Theoretically, you could tell someone the chances of them having blocked heart arteries is very, very high just based on their story alone, just based on symptoms. But to actually confirm it and prove beyond any reasonable doubt that there are blocked heart arteries, you would need some type of imaging study, like a nuclear stress test, a cardiac CT angiogram works in some people, just depending on age and some other factors. Sometimes that's an option. Coronary angiography or a heart cath, where you actually go in and inject dye into the heart arteries, that's the gold standard for diagnosing blocked heart arteries. But I want to emphasize that confirming blocked heart arteries is probably only important if you're having symptoms of blocked heart arteries. Imaging studies to prove that you have a blocked heart artery in an asymptomatic patient, that has a good functional capacity, they can walk a block or two and don't really have any symptoms, and there's really no suspicion of blocked heart arteries, is unlikely to do you any good and will probably just cost a lot of money without any useful information to be gained from it. Now, in somebody who is at high risk of blocked heart arteries, you don't necessarily need a study to prove they have it or don't have it. You're going to treat them to prevent blockages and prevent heart attacks, and you don't necessarily need an imaging study, for that to be successful.
Okay. All right, thanks. If I have coronary disease, will I need to take aspirin for the rest of my life?
Oh, depends when you asked that question. The answer 5 years ago was probably, yes. If there was really any evidence of coronary disease, not symptomatic, just, you had some asymptomatic coronary disease, or if you had lots of risk factors for heart attacks, the answer used to be yes, you probably need aspirin. Currently, the opinion has shifted to where unless you have severe coronary disease or symptomatic coronary disease or symptomatic peripheral vascular disease or carotid disease, strokes, you probably really don't benefit from aspirin. And the reason is, if you have never had symptomatic blocked arteries, again, it could be peripheral vascular disease, symptomatic carotid disease with a stroke, or coronary disease. If you've never had symptomatic blockages, not that you don't have blockages, but if they weren't symptomatic, the benefit from aspirin is actually very, very low. And it's so low, in fact, that the risk of bleeding on the aspirin is probably about the same, or in some people, a little bit higher. So you may gain a very small reduction in stroke or heart attack, but you may increase your risk of a life-threatening bleed.
Wow.
So when you weigh the risk versus benefit ratio, unless you've had symptomatic blocked arteries or maybe severe asymptomatic blocked heart arteries or peripheral vascular or carotid arteries, there really is not any benefit from aspirin that doesn't exceed the risk from it. Totally different story if you have ever had a stroke or had a heart attack or a stent or symptomatic blocked arteries. Those people, the benefit is much, much more.
Okay, wow.
So if you've had an event, you need an aspirin unequivocally. It's the best bang for your buck of any medication we have. If you haven't had a cardiovascular event, The patients are few and far between that you would recommend primary prevention aspirin for.
Okay. Wow. All right. The next question I think has come up in just about every episode with Baptist Heart doctors. It says, what are your thoughts on keto as it relates to heart health?
So you wouldn't have a question that frequent if it wasn't a pretty divisive issue. I get the sense with that question that the public isn't hearing what they want to hear, and they're going to keep asking the question until the answer changes, and the heart doctors say, it's a great diet, you should all be on it. But the truth is that enthusiasm for fad diets generally exceeds the evidence at a very fast pace. So I feel like people want it to be true because everybody knows somebody or themselves have had significant weight loss on the keto diet. And just to explain the keto diet a little bit, I am not a diet expert. Let me put that disclaimer out there. But I can tell you what I've read in my experience with treating patients who struggle with weight and that are always on fad diets. So the keto diet is an extremely low carbohydrate diet. Very, very low carbohydrate. Maybe 5% of your calories in carbohydrates, which is very unnatural. And it's not only low carbohydrate, but it's very high fat. And it's anywhere between 70 to 90% fat in the diet.
I did not know that.
It's crazy. It's an incredibly, incredibly high fat diet. And then protein is going to be the difference between the 70 or 90 of the fat and the 5% that you're allowed for carbs in this keto diet, which is extremely, extremely high fat. So it's really kind of just a version of Atkins diet or South Beach diet, which are also low carb diets. It's just the Atkins and South Beach diets tend to have more protein and a little less fat, but they're all low carb diets. There is no argument that high levels of carbohydrates, especially the processed carbohydrates that we have, the sugars, the sugary drinks, white bread, these very processed carbohydrates, there's no doubt that that's bad.
Right.
Unequivocally bad. The question is how much better the alternative is. So with the keto diet, the problem is, well, I guess first I'll answer the question from a heart health standpoint, right? How is it for your heart? And the truth is, I don't think anybody really knows. So if you look this stuff up, you can find some study somewhere to support just about any stance you want to take, because that's the way scientific literature usually is. But my Facebook page is going to blow up after this statement, but generally people with an axe to grind in support of it are going to be who have something to sell, are going to be the biggest supporters of it. And what you really want is you want to get your data from people that don't have a dog in the hunt, people who are just looking at the facts as objectively as they can, which again, you could argue whether there is such a thing, but generally speaking, on the keto diet, you will likely, if you do it right, that's the other thing.
Right.
If you do it right, okay, like the proponents say, your cholesterol profile will probably improve. Your good cholesterol will go up. Your bad cholesterol usually goes down. Unequivocally, it helps with blood sugar control. So so diabetics, will definitely get better blood sugar control. Again, it can goof things up just as bad as it fixes things. So you got to be careful when you're dealing with diabetics and blood sugars. But it does improve blood pressure in most people. So from a heart standpoint, short term, it appears to improve some of the things that we generally blame for cardiovascular disease. Now here's the catch. Almost all the studies of the keto diet only follow people out to about 6 months, because how long do you think you can realistically maintain eating nothing but, bacon and fat, long term? It's just not usually a long-term diet. So whenever we talk about cardiovascular risk, what we really care about is things, what happens after years of doing this, right? If you want to smoke 3 packs a day, it's still going to take 30 to 50 years for it to catch up with you, right? So just because the keto diet doesn't hurt you in the first 6 months and it improves some secondary endpoints, doesn't necessarily mean that it's good long-term for the heart.
Right.
It seems very unnatural for the heart and for the body, quite honestly. And, most things that are too good to be true are almost certainly too good to be true, right?
Yes.
So the keto diet, I think from a cardiovascular standpoint, what we can say is we don't have enough data and there's not enough long-term evidence, because this is just not a diet that people are on long-term. They typically are on it as a fad diet. It's not sustainable. They're going to be on it. They're going to lose 10 to 20 pounds. They're going to say it's the best thing ever. They're going to come off that diet, gain 30 pounds back just to get back on it, thinking that that's the answer. But from a non-cardiovascular health, just how do you maintain a healthy weight? How do you really lose weight where it's meaningful and it stays off? Is you just have to have good choices and self-control. decrease, choose the right foods, the right amounts of those foods, and exercise. And people want a pill or they want a quick fixes, and I do too. I wish there was. But
we grew up watching the Jetsons.
Yeah, exactly. It would be fantastic. But the truth is, obesity didn't used to be the problem 50, 100 years ago that it is now, because a lot's changed. We have a lot more poor food choices. Food did not used to be as readily available as it is now. Food didn't used to be as cheap as it is now. Good food's still expensive, but cheap food, you can fill up at McDonald's for $2 and get 1,500 calories. So, and we're not nearly as physically active as our grandparents and great-grandparents were. So everything has kind of come together in society for a perfect storm of rampant obesity, and the fix is hard. You have to make good choices and really take control of things. A fad diet is very unlikely the answer.
I like the way you put that. We've created our own perfect storm for it.
We just can't kill ourselves fast enough, it seems like.
We need to get out there and plant a garden and eat what's in there, right?
Yeah, try to live a little more like your grandparents did.
Sounds good. So while we're talking about foods, the next question is, it says, what types of foods prevent coronary artery disease?
If there was a food that prevented it, we'd all be eating it. The truth is, there are some foods that can slow the process down, that can make it less likely to occur. I'm not aware of any foods that actually will reverse it or cure it. The way I see it is, if they can't find a cure for cavities by now, the chance of finding a cure for coronary disease is probably well in line behind that. But foods that decrease the risk of coronary disease or that would slow it down would be vegetables. Vegetables. A vegan diet probably theoretically would be the least likely to lead to blocked heart arteries. But lean fish, lean chicken, staying away from the fried stuff, those are good choices too. I tell all my patients, you have to take some chances and you have to live a little, you have to enjoy your life. But most people play dumb and they act like they have no idea what got them into the situation that they're in now. But in reality, just make the decisions that are right. Just fresh vegetables, some fruit, lean meats, all the stuff that we've heard 1,000 times. But that pizza and that hamburger just looks so good that that's usually what we reach for.
Right, and it's quick too sometimes.
Quick and cheap.
So right, and you mentioned cheap, and sometimes our better foods are going to be more expensive. But if you think about the long run, that $2 fast food meal is going to cost you a lot in health care later on.
Nothing's free, guys. That's just the way it is.
All right, I'm going to take a few because we've got quite a bit over here on Facebook. Let's see. Tara says, "Is there a cure for heart palpitations?"
It depends. The truth is, heart palpitations can be to lots of different heart rhythms. In fact, some people have heart palpitations. They feel their heart beating funny, but when you put them on a monitor, there's actually nothing going on.
Wow.
It's just a altered sensation of a normal heartbeat. But in most people who do have palpitations, it's going to be skipped beats. Now, sometimes, very rarely, or I guess I should say uncommonly, heart palpitations can be something very, very serious, a sign of a very dangerous heart rhythm. But in the overwhelming majority of people, it's just going to be benign premature beats that may be just a premature beat or two and give you a funny little sensation in your chest, to a string of several premature beats, or even tens or hundreds of them strung together. But most of the time those are benign, which is the biggest thing, is determining whether it's dangerous or whether it's something that, as long as you can ignore the symptoms and they're not real frequent, just let it go. But if the palpitations are bad enough and they really bother somebody, there are medications that we can give that have a pretty good success at decreasing the frequency or decreasing the sensation of the palpitations. And what I usually tell patients is, if it's bad enough for you to want to take a pill every day, indefinitely, then yeah, we can definitely do that, and chances are that we will make them better. A lot of times they aren't cured.
Right.
It turns out there are pills that can cure them, but they have their own risks, and you don't want the treatment to be worse than the disease. So there are medicines that we can give if they really bother people, but I would say at least half the patients, they just want to be reassured that they're going to be okay and that it's most likely nothing dangerous, but they don't really want to take a pill if they don't have to take it.
Okay. Sounds like Rosalind may need to make a call. She says, "Hey, pain in the middle of my chest, please help."
Sure. So, you could be in the midst of a massive heart attack, or, it could be all the reasons that all of us get chest discomfort. I've had chest discomfort. A couple times a year I'll get chest pain, and I sit there and I think, if I didn't know any better, I think I was having a heart attack, and I'm still not certain. we talked about chest pain can be due to so many different things. Chest pain is probably the biggest complaint in the emergency room, but only a very, very few of those people complaining of chest pain is it actually even due to their heart. There's so many things located in the chest, kind of where the heart is. You've got the esophagus, you've got all sorts of GI organs, the gallbladder and the stomach, you've got the liver, you've got the lining of the lungs, you've got bones, muscle, nerves. There's so many things located in that chest area, and all of them can hurt. The problem with the body is that the body is very bad. The brain is very, very bad at deciding where chest pain is coming from. So you could have chest pain due to 100 different reasons, and the brain is just going to say, it hurts here. And that's why I said so many people have heart attacks and didn't even know it, but at the same time, there are just as many people that get expensive, sometimes a little risky cardiac workups that never really needed them because it wasn't their heart to begin with. You get a $1 million workup and a 25-cent send-off, and we say it wasn't your heart, but the bottom line is it is so hard to know if chest pain is coming from the heart or not, and that's why if it's really concerning, the only thing you can do is get checked out as quickly as you can. But generally speaking, unless you're having a heart attack will hurt sitting there doing nothing. But generally speaking, if the chest discomfort predictably gets worse with activity and better as soon as you quit, that's a pretty good story for the heart. But if it's just random chest pain that doesn't last too long and it happens when you're sitting there doing nothing, but you could go walk a mile with no problem, that's almost certainly not the heart.
Wow. Okay. Whoops. Let's see. My daughter was diagnosed with, it says it's POTS syndrome.
POTS.
Uh-huh.
So POTS, sure. So postural orthostatic tachycardia syndrome.
Okay.
And it's in a family of diseases called autonomic dysfunction. And that's a real long word for basically your body not regulating blood pressure and heart rate very well. Most people are going to have a pretty constant heart rate. When you're sitting down, it's going to be nice and low. When you stand up, it might go up a couple of beats just to kind of keep up with your physical activity. And the blood pressure will stay pretty similar whether you're lying down, sitting up, or standing up, or doing whatever. But in a small number of people, the heart rate and the blood pressure regulation gets kind of off the tracks a little bit. So patients with POTS, their heart rate, when they stand up, it goes up quite a bit, maybe 10, 20 beats per minute at least, sometimes more. So these patients, they feel pretty good sitting down, but when they stand up, sometimes immediately, sometimes after they've been up for a bit, they will get tachycardia. Their heart rate will go quite a bit faster than it really should. And like I said, sometimes their blood pressure will drop, sometimes it doesn't. It's not required. But POTS it's a very difficult disease to treat. There are a whole lot of things you can use, none of which work great. In any one person, they might find something that works terrific for them, whether it's just drinking an increased volume of sodium and fluids to try to keep the blood pressure up. In others, it may be medications to keep blood volume up, or medicines to constrict the vessels to keep blood pressure up. So there are all sorts of other things that kind of anecdotally or in small trials have worked, but you just kind of have to keep trying different things. And if you try kind of the usual, easy introductory treatments and those don't work, sometimes we send those people on to autonomic disease specialists. Where there's one at UMC, there's some in Birmingham and other kind of large referral centers that deal with these kind of very difficult family of autonomic disorders where your body just does not regulate heart rate and blood pressure appropriately.
Okay. Well, we've got lots of questions coming in, and we still have quite a bit more to answer from our Ask the Experts page too. So if we run out of time, you may have to go on Facebook and respond to everyone if you don't mind. Let's see. We have the next one. Another Kelly Ledger says, I have a question. Every once in a while, I get chest pains right on the left side. Is that minor heartaches?
Who knows? Hard to say. So, again, chest pain, it can be anything, everything, or nothing. If you are a 30-year-old who exercises 5 times a week and you feel great and you get occasional chest pain, it's extraordinarily unlikely that is a blocked heart artery. And when you talk about chest pain or heart pain, pretty much everything we're talking about is it a blocked heart artery or is it not? Because a blocked heart artery is really the only thing that would cause chest pain with any frequency. So if you are the right demographic to have blocked heart arteries, like, middle age or older, diabetic, hypertensive, smoker, well then yeah, there's an increasing likelihood that that's a blocked heart artery. If you're 20 or 30 and exercise and otherwise very healthy, the chance of that being a blocked heart artery, while not zero, is really, really low, because that's just not the type of people that get blocked heart arteries. So if you're someone who there's a likelihood that you would have blocked heart arteries based on your risk factors, and the symptoms, again, generally get worse with activity. The more you do, the worse they get. You stop and they pretty much immediately go away or start going away pretty quickly. I'd be pretty concerned about a blocked heart artery. But if it's just random chest pain, nothing seems to bring it on, nothing seems to make it go away, and you don't have a whole bunch of risk factors, all you can do is say, from a probability standpoint, I don't think so, but you can never say never and you can never say always.
Wow. Okay. Alana Lynn says, hey, Dr. Gill, do you have a fan there?
Hi.
Okay.
One thing. I'll take it.
Sandra Scott, let's see. I recently had a second TIA after 6 years since the first. Should I seek a cardiovascular assessment?
Definitely need to see somebody. I would have done that after the first TIA. But 2 TIAs, assuming they really were TIAs, yeah, that would suggest you've got garbage, going up the arteries to your brain. So that's not good.
Oh, no.
So yeah, they're pretty standard workups. Honestly, cardiologists can do that workup. Primary care doctors can do that workup. Neurologists can do that workup. Vascular doctors, vascular surgeons can do that workup. So the workup for any type of cardiovascular disease can often be done by multiple providers. It's honestly not that hard.
Wow, okay. Will you tell everyone what a TIA is?
Yeah, it just stands for transient ischemic attack. It's kind of like a reversible stroke. Whenever we say the word stroke, we imply that brain tissue has actually died. But with a TIA, those symptoms are usually reversible within 24 hours. So you will have symptoms that are identical to a stroke. They just are completely resolved within 24 hours. So you kind of dodged a bullet, but the second bullet might get you.
Okay. Macy Kane, she had the question about heart murmurs earlier, and she said thanks, and she said, I'm having surgery in the morning, and it's so funny that I had to point it out to them before they took a second listen, and now she's having surgery. Best wishes on your surgery, Macy.
That's right. Good luck, and chances are the heart's okay.
Good. All right. I'm going to take one more of these, and we're going to get back to the questions from the Ask the Experts page, try to make enough time. Mary says, good morning. What causes rapid heartbeat when the heart is in resting state?
That's back to the palpitations thing. So whenever the heart is beating fast, I guess the subjective sensation of that is what we call palpitations, when somebody's got a conscious awareness of their heart beating fast or skipping beats. So when the heart speeds up for no good reason, right? You're just sitting there and everything's going fine and your heart literally, starts racing or going faster than it should. There are all sorts of things that it could be. It could be just that list of what we call supraventricular tachycardias, and that just means the heart is an electrical organ. It runs on electrical impulses, and it's got a designated sequence of who's in charge of generating each heartbeat. So if somebody decides that they want to hijack the heartbeat and beat faster than the guy who's in charge, well, they can take it over and beat as fast as they want. Typically, that's not sustained. My guess is that your episodes probably last seconds to maybe a couple of minutes. And then they resolve most of the time, as long as you're, otherwise healthy, can walk a mile or two, no trouble. Usually those are just nuisance things. But, if you're sitting around doing nothing and your heart's beating really fast for, 10, 20, 30 minutes, an hour, and it does it frequently, that probably needs to be looked at. But most of the time, those are going to be benign things that are just a nuisance. It's just hard to tell, and the list of things that can provoke that is long. Caffeine, even though we blame it for probably a lot more palpitations than it actually causes, but it can make it worse. Rarely thyroid disease, there are other things, and sometimes the heart, because it's electrical, it just gets little electrical glitches and it's going to do what it wants to do, and as long as it doesn't do it for too long, or you're not real symptomatic when it happens, or it doesn't do it real frequently, a lot of times we just, maybe a quick cursory workup to make sure it's nothing dangerous, and then, just hope it goes away. And these palpitations and these fast heart rates, they tend to cycle. It's usually in kind of younger to middle-aged folks. It's probably the most common demographic. And generally speaking, these people, they'll get bad episodes for several weeks to months, and then it will go away or improve quite a bit for months to years, and it'll just come right on back for another, weeks to months, and it just cycles through these periods of exacerbations and then periods where it'll get better. And that's just kind of the natural course of it a lot of times.
Okay. Jan Little asks about the keto diet. After the live is finished, Jan, if you'll go back, Dr. Gill gave a very in-depth response to that question just a few minutes ago, so you'll get a good answer.
I'm not sure it was correct, but it was a detailed response.
It was. Okay. What can happen if coronary artery disease goes untreated?
Well, you can die, but that's a worst case scenario.
Okay.
So coronary disease implies there are a couple of different types, but the main type is just blocked arteries because of cholesterol and plaque buildup in the arteries. All right, so if you're blocking the artery that takes the heart blood, so the heart is muscle, and the heart muscle has to have the oxygen in the blood to stay alive. If you cut off that blood, well, it's going to die. So if you've got blocked heart arteries, the heart will get fussy, it will get chest pain. Generally speaking, the more you do, the worse it's going to get, because when the heart is resting, even with fairly blocked heart arteries, usually the heart gets enough blood to make itself happy, right? If the demand for blood isn't that high in a resting heart, well, you're usually not going to get symptoms of, chest discomfort or shortness of breath or whatever. But when you start making that heart work harder, just like any muscle, it's got to increase its blood supply. And if there's a blockage so bad that it can't increase that blood supply, then you're going to get this exertional chest pain. Now, generally, a blocked heart artery that just causes chest discomfort, when you're milling around, that's not going to kill you. It may cause some symptoms. You get some chest pain with activity, but it's not actually damaging the heart muscle. When coronary disease becomes dangerous is when it causes a heart attack. And that's a little bit different than just stable blockages in the heart arteries that really aren't hurting anything. And blocked heart arteries that cause a heart attack, those are largely unpredictable. A lot of people look surprised at me when I tell them that heart attacks are mostly unpredictable. I tell them, if we had something that could predict a heart attack, well, people wouldn't have heart attacks because we would order that on everybody. So heart attacks are fairly random events. Now, most people with heart attacks, you could have easily identified that they were at increased risk for heart attacks, but you can't predict when a heart attack is going to happen. Theoretically, I could see a patient today, they could be feeling great, and then tomorrow they could have a heart attack, and it wasn't because I missed something or didn't order a test, because there's just currently no test that can tell you, tomorrow, next week, next year, you're going to have a heart attack. Hopefully there will be one day, but there's really nothing close to that right now. So the answer is, to the worst case scenario of blocked heart arteries is a heart attack, which kills the heart muscle, and if you ain't got a heart, you're not going to make it very long. So to prevent heart attacks, the answer is usually not ordering a whole bunch of tests. Sometimes you do want to order some tests. It just depends on the situation. But the most benefit that you get for preventing the heart attack that will block the artery, that will kill part of your heart, is to control risk factors, to control diabetes, or prevent it altogether if possible, to control high blood pressure, to lose weight, to exercise, to eat right so that you don't get diabetes and high blood pressure to the extent that they can be prevented sometimes, to eat right, to decrease your cholesterol, if you have high cholesterol, to take the medicine that decreases your cholesterol. So all of those things go into reducing the risk of the heart attack that could theoretically kill you, even though really most heart attacks don't kill people. Now, no heart attack is good, but God makes you with more heart muscle than you have to live. So just like you can live with one kidney, you can live with a little bit of damaged heart, but you don't want to lose any more than you have to.
Yes, thanks. Okay, I'm not quite sure what's being asked here, but since you're the experts, you probably will. It says, Lisa Marie says, so my husband had 2 stents put into his arteries, but still has pain and shortness of breath. He is 55 and overweight. One doctor said his Sneller veins that cannot be operated on. It says bot, maybe not. So meds can help. One doctor said the same thing, but refuses to put him back to work. He is a corrections officer. It says, what is his scoprions? I wasn't sure what that was.
I may or may not answer a question that wasn't asked. Let's see. So I think that what she's saying is that he had some blocked heart arteries. They put some stents in, still having the symptoms, shortness of breath and chest pain. And that maybe there are some small vessels, some small arteries of the heart that couldn't be fixed. So, the heart arteries are like branches on a tree. They start off big, and as you go further down, they get smaller and smaller. The smallest stent that we have is 2 millimeters in diameter, and that's pretty small.
Yeah.
Heart arteries go to, as tiny as you can see them. They get so tiny until they get microscopic. So if a heart artery is smaller than 2 millimeters, maybe sometimes even just a little bit bigger than that, there's really nothing you can do. They're too small to bypass, they're too small to put a stent in, so you just have to treat that with medications. Now, I don't have any medications that nobody else has, and sometimes, as much as you hate to say it, all you can do is all you can do. So you fix everything that is fixable with stents or bypass. And then, you try medicines, you maximize all the medicines that exist, to try to get rid of that chest discomfort. And if you've done everything you can do and still symptomatic, then sometimes that's just where you're stuck. Not every problem is fixable. But the other issue is, that's all assuming that the chest pain and the shortness of breath are due to blocked heart arteries. So I know you said that he's obese and he's probably at least middle age. If he has blocked heart arteries, he may or may not be diabetic, hypertensive, high cholesterol, etc. But if he's not in the best physical shape of his life, and just wear and tear, age, obesity, deconditioning, that could easily account for a lot of the shortness of breath. Now, it may be 100% cardiac. There's just no way to know. And even if you do every test there is, you can't sort it out, right? You just fix everything you can fix. And what doesn't get fixed, sometimes you're just left with. So it's just every patient is different, and it's kind of hard to comment on specifics. But yeah, if they're small arteries, there's nothing you can do to open them. Now, the smaller the artery, the less important it is. Usually small blocked arteries won't kill you. They may or may not cause, symptoms of angina. But there's certain things that just aren't fixed. But basically, if they put the stents in, there's nothing left to stent, and he's on all the medicines. It's possible that's where he is. But I think, to the extent that he could lose weight and improve his exercise capacity, sometimes that helps a lot too.
Okay, thank you. Amanda says she saw you last week. She says, I saw Dr. Guild last week, absolutely loved him. He listened so well and took notes on me like I've never seen.
I hope my wife heard that. Well, that's very kind of her. Thank you very much.
All right. Let's see. Tara asked, do you have to have a recommendation to make an appointment with Baptist Heart?
A lot of times, it depends on your insurance carrier. So, if you're an insurance provider, you don't want every patient you got, going to a heart doctor, because a lot of times the patients don't know if they really need a heart doctor. Primary care doctors can do so much, and they're so good at what they do that they might be able to say, honestly, I hear what you're saying, I hear your symptoms, but wow, you just don't need to go to the heart doctor and waste your money, right now for that. So most insurance companies require a referral from another healthcare provider, but some don't. Some let you just, make an appointment and schedule it.
Okay. Jeff says, I came in and had the workup that Baptist offers for $150 early this year. Have burning pain at times, hips and legs. I assume it's not a heart issue. I'm thinking sciatica.
Almost certainly not a heart issue, which is the good news. It's tough. Sciatica, it's a pinched nerve, and that nerve runs right down the back of the leg there. And it can also cause, if you remember earlier in the discussion, we said that leg pain that gets worse when you walk and gets better when you stop walking is oftentimes a blocked artery in the leg, because it makes sense. The more you make that muscle work, by walking further, and it can't get enough blood flow, well, it's going to get fussy. It's going to hurt until you stop. But nerve pain can be kind of similar. A lot of times you can at least make an educated guess as to whether it's mostly neurologic and sciatica or truly claudication, which is what we call it when a blocked artery is causing pain in the muscles. But the truth is, I've seen people that I thought it was a nerve and it was a blocked artery, and vice versa. So, that's why we invented tests to determine it. So, your regular care provider, if they think that the story has any ambiguity to it and it might not be a blocked nerve, not a blocked nerve, but a compressed nerve, and it might be a blocked artery, they can order a simple test where it just looks at pressures in the leg, and if those pressures as you go further down the leg are reduced, that's a good case for a blocked artery.
Yes, definitely. Okay, that was our very first question, I believe, so you can get that information at the beginning. All right. Misty says, I have had rheumatic fever 5 times. How does that affect your heart? I have been having swelling in my hands and feet when I walk.
Rheumatic fever, that's a bummer. So if you had rheumatic fever that actually caused rheumatic heart disease, so when you get rheumatic fever, it's usually a sequela of untreated strep infections, and the immune system actually attacks the heart, and what we usually see is when it attacks the heart valves. Now, a lot of people that had the rheumatic fever and their body attacked their heart valves, they may not have had any heart symptoms at that time. A lot of times in childhood or young adulthood, and you don't actually get symptoms of the valve disease from rheumatic fever until, adulthood, sometimes even, 30s, 40s, 50s, 60s. To answer the question of, do we think that the rheumatic fever is causing the swelling in your hands and feet? Lots of people have swelling in their legs, especially women who have had children are going to have, varicose veins or venous insufficiency. So, mild to moderate swelling in the legs in women, in their 30s and 40s, 50s, 60s, it's more common than not, okay? So swelling in the legs is not super specific for heart disease or valve disease. Swelling in the hands, to my knowledge, is almost categorically never related to the heart. So whenever you've got problems with the heart, you tend to kind of act like a tub. You're going to fill up from the bottom up, so it's going to start in your ankles and come up those legs, but the hands are almost never affected from what we would call heart failure or high filling pressures in the heart, which is all we would really care about from a heart standpoint with valve disease. So swollen hands, it's almost certainly salt intake or hormonal, or I don't know what the deal is, but sometimes after I exercise in hot weather, man, my hands will swell up tight as a tick. So, swollen hands, very, very unlikely the heart, which may or may not have anything to do with your legs. But if you truly had rheumatic fever, especially several times, it would seem almost certain that you had an echo or ultrasound of your heart, all right? So if the ultrasound of your heart says bad valves, well, I'd be concerned about that, especially if you have symptoms of shortness of breath with activity. That's usually the main thing that bad valves cause. But if the echo said, no, your valves are fine, or just a little mild or moderate leak here and there, mild to moderate valve disease should really never cause symptoms. It should never cause swelling. It shouldn't ever cause shortness of breath. That's why we call it severe. We call it severe usually when it would be bad enough to be causing a symptom. So mild to moderate valve disease, wouldn't worry about it. But if you've had rheumatic fever that many times, if you hadn't had a heart ultrasound, you need it.
Dr. Guild, tell the viewers how they can get in touch with you and find out more information on Baptist Heart.
Sure. So that telephone number is 601-968-1966, and I believe also through the internet at baptistheart.org.
That's right. So we have over 40 questions left to be answered, but unfortunately we are out of time. I think we've gone a little over here today. Lots of people with questions about heart, but we will work with Baptist Heart and Dr. Guild and some of his colleagues to get those answers for you. Of course, you can submit them to the Ask the Experts page, so the next time Dr. Guild or one of his associates come on, we'll get those answers for you all. I thank you so much for coming in today. This has been just a wealth of information for everyone. We're going to have Baptist Cancer Center on next Monday. Same time, I believe, 10 a.m. Not sure which doctor's coming. Do you know?
I don't know.
Yeah, so you'll learn about hearts this week. It'll be cancer next week. But we will work. If your questions didn't get answered, we thank you for all your questions. We'll get those answered for you today. Thank you for questions. Thank you for watching. This is WLBT's Ask the Experts.